I am about to tell you something that may truly surprise you, something that could be resting inside your bathroom cabinet at this very moment, quietly harming the most vital organ in your entire body. I am Dr. Sarah Collins, and after more than 20 years as a heart surgeon, I have seen people who seemed perfectly healthy arrive at my operating table with hearts damaged not by illness but by medications they believed were completely harmless. These are not rare drugs or experimental therapies. I am talking about the painkiller you took earlier today, the stomach pill you swallowed with your breakfast, and even the cold medicine you grabbed last week without giving it a second thought. What you are about to hear goes against practically everything you have been taught about these supposedly safe medications. Pharmaceutical companies do not highlight this information, and most physicians never mention it because they are unaware of the hidden impact, but I have witnessed it repeatedly, patient after patient, heart after heart, and I cannot stay silent any longer. Before this video ends, you will know exactly which 5 common medications can slowly weaken your heart, why they become more dangerous after age 60, and most importantly, what steps you can take starting today to protect yourself. This is not fear or exaggeration, it is essential information. Stay with me because what you are going to learn could realistically add years to your life, and we begin with the medications found in almost every home, the non-steroidal anti-inflammatory drugs, or NSAIDs. You have heard them called ibuprofen, naproxen, and diclofenac. They are the pills you rely on for headaches, back discomfort, arthritis, and everyday aches. They work extremely well, there is no denying that, but here is what most people never hear: taking these drugs consistently after age 60, especially if you already have any cardiac risk, is like playing a dangerous game with your heart. The medical world has known this issue for decades. Back in 2005, the FDA ordered clear warnings about increased risks of heart attack and stroke on these labels, yet millions still take them daily as if they were harmless, unaware of the threat hidden in each dose. Let me tell you about Michael, a 72-year-old who loved caring for his garden. He had chronic knee pain and took NSAID nearly every day. One afternoon, while tending to his plants, he suddenly felt exhausted, short of breath, and noticed his ankles swelling dramatically. At the hospital, we discovered he was suffering acute heart failure. His heart, already strained from aging and mild hypertension, simply could not keep up. The trigger was not a new disease, it was the constant intake of that seemingly innocent anti-inflammatory pill. How can such a familiar medication be so harmful? The mechanism is subtle but powerful. NSAIDs block enzymes to reduce inflammation, but in the process they interfere with compounds that keep your kidneys and blood vessels functioning properly. This leads to 2 major problems. First, they cause your body to retain fluid in the sodium. Picture your heart as a pump. If the pipes suddenly contain far more fluid, the pump has to work at full force. Younger hearts tolerate this, but older ones may not, just like what happened to Michael. Second, NSAIDs tighten blood vessels and elevate blood pressure. Even if you have never had hypertension, regular use can raise it noticeably, and if you are already taking medication for high blood pressure, NSAIDs can undo its effects, allowing your pressure to climb dangerously without you realizing it. Risk depends on dosage and how long you take them. Drugs like diclofenac and high-dose ibuprofen, around 2,400 mg a day, appear most strongly linked to cardiac complications. Lower-dose naproxen might be somewhat safer, but the danger never fully disappears. And here is an unsettling detail: if you take low-dose aspirin for heart protection, ibuprofen can actually block that benefit completely. So what can you do? The goal is not to live in pain, it is to talk honestly with your doctor. Ask, given my health history, which pain reliever is safest for me? Sometimes acetaminophen works well, other times topical treatments that act only on the skin, creams or gels, are better options, and if NSAID is truly necessary, always use the smallest dose for the shortest period. Now let us move to number 4. This one surprises almost everyone because it is marketed as a stomach protector: proton pump inhibitors, or PPIs. Omeprazole, pantoprazole, lansoprazole. These drugs are among the most commonly prescribed worldwide. Millions take them each morning as if they were vitamins, either for reflux or to shield the stomach from medications like NSAIDs, and the irony is painful. The drug meant to protect you from one issue may quietly create another. Let me introduce you to Helen, 68, who was prescribed omeprazole for chronic reflux. She was told to take it indefinitely. Her symptoms disappeared and she never thought about it again. Years later, during a routine exam, her EKG looked abnormal. Blood tests revealed extremely low magnesium levels. Magnesium is essential for stable heart rhythm. When it drops, the heart becomes electrically unstable like an orchestra losing its conductor, and dangerous arrhythmias can begin to cause. In Helen's case was long-term omeprazole use. PPIs lower stomach acid, but that acidity is vital for nutrient absorption. When it is consistently suppressed, magnesium absorption falls dramatically, but there is more. Several studies have found an association between PPIs and increased risk of heart attacks. One theory is that these drugs may reduce nitric oxide, a molecule that keeps vessels flexible. When nitric oxide drops, blood vessels stiffen, which sets the stage for heart issues. Although the exact cause is still debated, the concerns are serious. Omeprazole can also interact with important medications like clopidogrel used after heart attacks. It can weaken the effectiveness of this life-saving drug. The real problem is how casually PPIs are used. They were designed for short-term use, 4 to 8 weeks, but many people take them for years. If you have been using them long-term, do not stop abruptly. Ask your doctor whether you actually need them, whether the dose can be lowered or if alternatives exist, and if you must continue. Regular magnesium testing is essential before we move to the next group of medications, which includes some used for simple colds. I want to ask a small favor. If you find this information useful, I invite you to subscribe to this channel. My goal is to provide clear and practical health guidance so you can make informed decisions, and please share this video. Think of your parents, relatives, and friends. A single click might spark a conversation that genuinely protects someone's life. Thank you for your support. Let us continue with number 3. AIM medication. Almost everyone keeps at home oral decongestants for colds and flu. The ones containing pseudoephedrine or phenylephrine, they seem like the perfect solution for congestion that will not go away, but that quick fix comes with a steep price for the heart, especially if you already have high blood pressure or any cardiovascular condition. Margaret, a 75-year-old retired teacher, caught a strong cold. To breathe better, she bought a common cold remedy containing pseudoephedrine. By the second day, her heart was racing, she felt dizzy, and she developed a pounding headache. Her son had to take her to the emergency room. Her blood pressure had soared and she had developed an arrhythmia. The decongestant had pushed her system beyond its limits. Why does this occur? Pseudoephedrine and phenylephrine are vasoconstrictors. They tighten blood vessels inside your nose. That is helpful because it reduces swelling, but these drugs do not stay confined to your nasal passages. They circulate through your body, tightening vessels everywhere. This leads to two serious issues. First, narrowing the arteries forces your heart to push harder, like trying to spray water through a hose someone is squeezing. Blood pressure rises rapidly. Second, these drugs act as stimulants. They increase heart rate and can trigger irregular rhythms. If your heart is already vulnerable, this stimulation can cause major problems. Recently, European regulators renewed warnings about pseudoephedrine due to rare but severe events involving restricted blood flow in the brain. This highlights how potent its effects are. The biggest danger is that these medicines are sold without prescription, so people buy them casually and overlook the warnings. If you are over 60 and especially if you have hypertension or any heart disease, avoid them completely. Safer choices include saline solutions, humidifiers, or nasal sprays that act locally. Do not let a simple cold remedy become a cardiac emergency. Now let us move to number 2, an important topic related to mental health. I am talking about an older class of antidepressants still used sometimes for anxiety, depression, and chronic pain. Tricyclic antidepressants such as amitriptyline and imipramine. Treating depression is crucial, but the type of treatment can significantly affect the heart. In older adults, Frank, 70 suffered from nerve pain due to diabetes. His doctor prescribed a low dose of amitriptyline and eased his discomfort, but he began feeling dizzy whenever he stood up. One day he fainted and fractured his hip. The cause was orthostatic hypotension, a sudden drop in blood pressure when standing triggered by the medication, and that is not the only risk. These drugs can increase resting heart rate and place additional strain on an older heart. Even more concerning, they can interfere with their heart electrical signals, slowing conduction. This appears on EKGs and raises the risk of dangerous arrhythmias. For these reasons, tricyclic are not the preferred option for older adults. Newer antidepressants are much safer for the heart. Still, tricyclic are sometimes used for nerve pain. If you or someone you care about takes one, speak with a doctor. Are safer options available? Are heart rhythm and blood pressure being checked? Finally, we arrive at number 1, a controversial topic: calcium supplements. Yes, the tablets many people take. They Why to prevent osteoporosis? For decades the advice was straightforward: take calcium to protect your bones, but more recent studies raise questions about how safe these supplements are for the heart. Consider Linda, age 70, worried about bone density. She began taking high-dose calcium on her own. Years later she suffered a heart attack. She lacked many common risk factors. Her cholesterol and blood pressure were normal. When doctors searched for possible causes, her supplement habit came under scrutiny. The science is not fully settled, but concerns exist. Calcium from food, dairy, and leafy greens absorbs gradually and does not appear harmful. The issue seems to be the rapid spike caused by supplements. When you swallow a pill, calcium floods your bloodstream. Your bones cannot use it all immediately, so the excess must go somewhere. The worry is that it may deposit in artery walls. This calcification stiffens arteries and can contribute to plaque formation. Some studies suggest calcium supplements slightly increase heart attack risk, while others find no connection. The evidence is mixed. For people with osteoporosis, the benefits may outweigh the risks, but one lesson remains: more is not always better. The safest strategy is to get calcium through food. If your doctor decides supplementation is needed, never start it on your own. It is a decision that must consider both bone and heart health. Today we uncovered the hidden risks behind 5 widely used medications: anti-inflammatories, acid reducers, decongestants, certain antidepressants, and calcium supplements. My intention is not to frighten you or tell you to stop your medications on your own. My goal is empowerment. Now you have knowledge many people do not. You understand that your arthritis pill might strain your heart. You realize your stomach medication could affect your heart rhythm. You now see how a cold remedy can become dangerous. Use this information to be proactive about your health. At your next appointment, arrive prepared. Bring a complete list of everything you take: prescription supplement, NTS vitamins, and ask direct questions. Doctor, is this still the safest option for me? Are there alternatives? Should we monitor anything specific as we age? The balance between benefits and risks changes. Your heart has worked for you your entire life. It deserves the best care. Protecting it is one of the greatest investments you can make. Never assume a medication is harmless just because it is common. And now I would like to ask one last favor: share your experience in the comments. Did anything here surprise you? Your story could help someone else. And remember to always speak with your doctor. That conversation might be the most important step you take today to safeguard your heart.